Well, today I want to talk to you about what coagulation testing to order and when. So, in general, if you're in the hospital, you mostly will come and get a PT or a PTT. But when do you order more specialized coagulation testing? And I'm going to talk a little bit about that today. We may not cover everything as it pertains to all the possible specialized coagulation testing that there is, but we'll cover the basics. All right. So when we're measuring hemostasis, that is the ability of the blood to go from bleeding to clotting, right? So that's a normal process. The patient starts bleeding and the processes are activated in order to form a blood clot. When we have a patient who's bleeding, hemostasis really involves two components. The first is primary hemostasis, and that's really, do the platelets work to come together to form a platelet plug? And the second is secondary hemostasis. And so are the coagulation factors able to come together to make a strong, vibrant clot? And so depending on whether there is delayed bleeding or not, so delayed bleeding tends to speak more to coagulation factor problems, as opposed to immediate bleeding, which tends to speak to problems with platelets. And so the type of coagulation testing that you order depends on what you're most concerned about. Okay, so if you are concerned that there is a platelet disorder or a disorder of primary hemostasis, you can start with a PFA or platelet function assay. Now, the platelet function assay is a screening test only. It doesn't really tell you what's going on with the platelets, but if it's abnormal, then it would lead you to the next test, which would be platelet aggregation studies. Now, platelet aggregation studies are studies in which you apply agonists that are known to activate platelets, and you add them to a sample with platelets, and then you watch and see if there is light that's able to pass through. And light transmission happens when the platelets are able to aggregate as they're supposed to. And so platelet aggregometry measures the light transmission over time. And initially, when there's still a cloudy suspension of platelets, there's not much light transmission. But as the platelets aggregate, then there is more light transmission. And so you get a curve that you're able to interpret. Platelet aggregometry can tell you about how platelets respond to certain agonists, and then you're able to make a determination sometimes as to which agonists are the platelets failing to respond to, or which combination of agonists platelets are failing to respond to. And that can tell you about what may be platelet impairment. And so it's important when you think about the platelets, think about their number. That's kind of primary. If the platelet numbers are low, it doesn't really matter what additional testing you want to order. So you want to check the number. But then the second one is to think about a platelet function assay. It's a screening test. If it's normal, you may not need to go into a platelet aggregation study. But if it's abnormal, you definitely want to go into a platelet aggregation study so that you can more helpfully quantify what's going on with the platelets. And in general, those are kind of like, it's like kind of like your first pass of evaluating primary hemostasis. One additional test that you could order is the von Willebrand panel, which tells you about von Willebrand antigen levels and the activity as well. And that also tells you about primary hemostasis, because von Willebrand factor is important in platelet-platelet interactions and in platelet endothelial interactions. So those are the four tests that you think about when you're evaluating primary hemostasis. The platelet count, you also evaluate the platelet function assay as a screening test. You can do the platelet aggregation studies to try to figure out which agonists the platelets are responding or not responding to. And then you also want to check a von Willebrand panel. So those are the things that are involved in primary hemostasis. Okay, how about secondary hemostasis? This really has to do with coagulation factors. So your basic tests are going to be your PT and your PTT, your prothrombin time and your activated partial thromboplastin time. If they are normal, then it's less likely that there is a coagulation disorder. However, it does not completely rule it out. So what are some situations in which you have a normal prothrombin and activated partial thromboplastin time, and there's still a problem with coagulation? This can happen where there's factor 13 deficiency. And so that's one of the things that you might do, is look for factor 13 deficiency, as it's a possible cause of delayed coagulopathic bleeding. All right. Other tests that you could order are, you could look at the fibrinogen. right? And one of the reasons to look at that is if you're thinking, could this patient have disseminated intravascular coagulation? I'm going to do a video on that in the future. And could this patient have disseminated intravascular coagulation? And you look at the fibrinogen to see how low is the fibrinogen. Usually a low fibrinogen will prolong both your PT and your PTT because fibrinogen, factor 1, is a common pathway factor. But that's something that you can look at as well to evaluate the coagulation pathway. Now, if the PT and the PTT are prolonged, remember you want to do mixing studies to determine whether it's inhibitor or deficiency, and then you want to check specific factor assays depending on what your PT and your PTT mixing studies tell you. All right. What about a thrombin time? When would you order a thrombin time? Well, thrombin time makes sense to order when you have a normal PT and PTT and you're concerned that there's coagulopathic bleeding. Now, the thrombin time really measures the conversion of fibrinogen to fibrin through the action of thrombin. And so the thrombin time, if it's prolonged, can tell you three things. One, it can tell you that there's anticoagulant on board, which is inhibiting the common pathway. So the thrombin time will be prolonged in that situation. It can also tell you that there is low fibrinogen levels. So hypofibrinogenemia can occur when the thrombin time is prolonged. It can also tell you about fibrinogen dysfunction. So dysfibrinogenemia. So the fibrinogen may be normal, but it's not working like it's supposed to. And so the thrombin time is typically prolonged in those three scenarios. When will you get whole blood clotting assays like the ROTEM or the thromboelastography, the TAG? Wow, those are really specialized testing. And for the most part, if you're ordering them, you should probably be talking to a hematologist. Sometimes they're used to guide massive transfusion protocols, as in patients who are massively bleeding or in patients who are undergoing surgery. And sometimes they are a component of surgery. So they're specialized tests. They're not tests that you're going to be getting routinely, but they do give you a big picture view of whole blood clotting. All right, so that's the summary of testing that you might want to get, depending on whether you think it's a disorder of primary hemostasis or disorder of secondary hemostasis. I hope that's been helpful to you. All right, I hope to see you next time. If you have a specific thing that you want me to cover or question that you have, please feel free to send it my way, and I'd be happy to answer. All right, have a great time. I'll see you next time.